Good evening, all of you. It is my pleasure to be here. I'm really thankful to Mr. Islam Adra, he's the chairman of this respectable, I think, event, the IOSH, and Mr. Santosh Prabhu. And I'm really thankful to Mr. Balashar Singh. He's my brother. Every time I fly anywhere in this part of the world, I always go through the Dubai. Tomorrow afternoon, I am flying to France for a couple of days. And 2 days back, he told me, if you agree, then we can have planned such a program. See, I'm telling you, I have been this joint replacement surgeries for more than 2 decades. I've been doing this. I've been in different parts of the world. Mostly I've been trained in USA. I've been in different parts of the USA. Also keep on going there because I'm a FACS. I'm a fellow of American College of Surgeons. I have a license to work in that part of the world. I had the opportunity to work with the surgeons here in California. And he used to say there's a huge load of these joint replacement surgeons, joint replacement surgeries. Patients are waiting for this knee replacement, hip replacements. And there has to be end of this. So we have to train the community. You should go and talk to this community, how you can prevent it, how you can delay it. This is very important, I think more important in Asian countries. Because in Asian countries, I worked in India. I have a license to a couple of Asian countries to go and work. We have seen that a huge load is there for the patients waiting. They're very scared. And rightly, the bad thing is they are young guys, very young guys, they are come up with the problem, with the knee problems. Because maybe their lifestyle is related, maybe they do not know how to care of the knees. It is a high time now to care of our knees. At least we should not sacrifice at least 100 years. Rightly tell Mr. Aslam, I operated 104 years old patients in India. His knees are very good. He had fell down, he had a fracture in the hip, I replaced the hip. But see, 104 years old, his knees are absolutely fine. He's still alive. Right now, he's 105 years old. It means that whatsoever knee is with you, knee joint, it could be more than 100 years. So why it is damaged in 60 years, 65 years, 70 years? Why? We have to find out the reasons. That's why I'm here. Because everywhere I find the opportunity to go and talk, to interact this common, it is not only here. If you say, get another talk, after 1 hour, I'm ready to give. Because if I can make you understand how to get the better life, better quality of life, because you know what we are doing in the joint replacement surgeries, that is a compromise. Anything you compromise, result is compromise. And another thing is that what is the relation, why we have chosen this back and knees, because these two things are interrelated. The thing starts with the knee, it goes to the back. End of the day, it's difficult to make out which comes first. Knee problem comes first or back problem comes first. Because if you're driving a car, if the alignment is not right, then definitely it will affect your tire. If you keep on changing the tire, it doesn't make a difference unless you align the car, something like that. You have to walk properly. When there is a problem in the knees, we can't tell you, there is a lurch. When there is a lurch, it affects the spine. End of the day, we do not know whom to go, whom to consult, which problem is more important, back problem or knee problem, which problem we should address first. If you go to the knee surgeon, he says you go for the knee surgery. If the back surgeons, you go for the back surgeries. You do not know exactly. We'll let you know what you should. These are basically, it will be a comprehensive, interactive. You can, end of the day, you can ask me questions also. You see, the back problem, it is the most common cause of office absentees. It is all over the world. And 1% US population is disabled. Every year, 15-20% will have the back pain. It is a huge load. Cost of society is 20 to 50 billion per year. In the US, there is no definite data in the Asian countries. This is the USA data. If you consider the spinal cord, in the neck part is the cervical spine, and the below part is the lumbar spine. These two parts, neck and back, these two parts we frequently move. If you talk, I'm moving my neck. In any case, these two, in between, this part is called the thoracic spine. The 12th vertebrae is there. This is the less movement is there. More movement in the neck and more movement in the lower back. So these two places are more prone for degenerations, more problem in this means pain. I'll give you the rough idea what exactly is this. Why this is the bones? What for this? This is the disc. Basically, this is a shock absorber. And this gives the space for these nerves. These nerves are responsible for doing everything. There are two hubs on the right side and left side. Right side nerves is responsible for the right side and left side is the left side. Okay? And these nerves comes out everywhere, starting from the cervical spine to end of the lumbar spine. Everywhere these two nerves coming out in both the sides. Discs, it makes the space. This is the normal. How it happens, why there is a back pain. Sometimes what happens, one is a acute, one is a sedentary lifestyle. Sedentary lifestyle doesn't work. We just go and we sleep. Sedentary means we don't move much. These guys are more prone when sometimes if they need to pick up some weight, or the leisure time, they are having some leisure time, they lie down in the wrong ways, their sitting posture is bad, they can come across this problem. Acute problem, it can come across with any guys, but whose muscles are more stronger, they can come across this problem is more strongly. Slips, trips, this can come across your back problem. This is because many of you are in the working, you works like this. This is the working pattern where you work. Sometimes you have to bend forward to come across your need of the professional need. In that case, you may have a chronic back problem. In that case, what you can do, you can elevate your working platform. It should be absolutely at the level of your chest when you need to go down. If you are going down for the long time, you can have a chronic back problem, which sometimes doesn't go even with the proper treatment also, because until unless you change your posture. This is another very important design, risk reductions in engineering design, how you lift the weight, that is very important. This is necessary when you're shifting from one place to other place, if you're shifting your residence or shifting something else. You never go for the bigger packet. You go for the smaller packet, and it will be better in the handle if you can pick it out of the handles. With the bigger one, if you try to pick it up, there is more chances you have a back problem. If you really want to pick up something from the floor, how do you want to pick? This is the proper way you should do it. This is the proper, it should be as close, this knee should be wide open, and this weight should be as close to your body. This is the proper way you should pick up weight. This is another important thing. You try to push something, some stone over there. There is a tremendous pressure you're generating here. It goes your back. It affects your back. See, this is a disc. This is coming out. This is putting pressure over here. You try to do something. Suddenly there is a catch in the back, and it radiates to it may be either side, right side or left side. If it is in between here, then it can affect both sides. But mostly, more than 90% cases, either side, either right side or left side. Because it compresses this is called the sciatica pain. This is the radiating from the nerves is originating here, and where it works, if it works in the back of the thigh, it gives you pain in the back of the thigh. If the front of the thigh, you will have pain in the front of the thigh. This is the gel. Basically, this is the gel inside, outer side of the fibrous part. This is the gel part. Basically, the nucleus pulposus. This comes out, and it puts pressure on the nerves. This is the left side. This is the right side. The nerves, the side affected, the persons will have pain in that particular sides. This is the sign, this is putting pressure on these nerves. What do? We remove what is the treatment basically? We remove the disc and put an artificial disc. This is the artificial disc right now available. We can make this space. Until unless you remove it, this nerve is always in agony, and it will be a tremendous pain down the way it works. This problem could be the neck. It could be the mid back, it could be the lower back. Mostly it happens in the neck and lower back. But if it could be the hips. Hips means these joints. This is the joint, the hip joint. And maybe the base of the spine, lower back. The person who is sitting for the long time, hurt surface, he or she can have pain in the tip of the spine. This is called the coccyx. That is a very bad problem. Most common cause is back problem is the stress. You have a tremendous back problem and it is not being relieved. For a couple of years you have this problem. Every 15 days, 20 days you have this problem. This is the stress. You are doing everything. So you have consulted a couple of doctors, couple of investigations done, and end of the day, nothing much in your MRI, but still you have a not being relieved with this pain. Stress. Most common cause of stress, anxiety, emotional worries. These are the most common cause of this chronic back problems. You are having a lot of works in your working place. You are not being properly relieved, but you have to drive along. You have been in a traffic jam and give a lot of stress, and this stress is the most common cause. The back pain is sudden onset. If you fell down or the sleeps, that may be sudden onset. Continuous, if something your nerve is already compressed, then you may have a continuous pain. They're not relieved, maybe up and down. Then some pain is exaggerated. While you're doing exercise, otherwise you're perfectly fine. While you do some starting exercises, you started pain, or you some passing urine also, because there is a tremendous pressure inside, you can have the pain. Or if there is a cold, very cold, if there is a muscle spasm is there. These are the conditions. This is exaggerated. It means otherwise you are perfect. When there is too much of cold, you have a problem. When you are putting some pressure, try to putting out pressure in the putting. It means that the pathology is already there. When you are putting the pressure, the muscles are not taking care of that. Then anything giving pain means your nerves, the particular spinal nerves, in trouble. Then pain going to the legs. It is the most dangerous signs. That is called the common people called the sciatica. This pain started from the back and it goes from the back of the legs and to the tip. Sometimes you may feel the numbness also. Now the most common problem is osteoporosis, because right now this is a global problem, osteoporosis. It means the weakening of your bones. If you have osteoporosis, you may have problems in all over the joints. Mostly the ends of the joints will be painful. But it is serious issues. Mostly the females are suffering from this osteoporosis. Even in the Western world also, they have this problem, more in the Asian countries, because their food habits, and they are more probably genetically they are more prone for this osteoporosis. Osteoporosis means they are more prone for fractures, they are more prone from the aging of the joints. And another thing is that the very global issues right now, how to care of this osteoporosis, because when there is a fracture, trivial trauma can come across fractures and it doesn't heal, because to heal the fracture you need a calcium, it is not there. Another, kidney infections. If there is a stone, you have a problem in the back, but you are consulting your orthopedic surgeons, he is treating your body, you are not getting relief. You may have problem in the kidney stone, kidney infections. Mostly if you have a problem in the mid part of your back, this part back, then you have problem in this kidney infections also. That is another common cause. If it is not being relieved with this proper treatment of this back, then you should go for at least a ultrasound to know what is the status of the kidneys. Even in some of the stomach ulcers also. If there is ulcer in the stomach, foot back, you may have a problem in the back, pain in the back. Female, most common cause gynecological cases. Young females, your premenopausals, your childbearing age groups, if they is having severe pain in this back, sometimes it could be a cause of the gynecological, means some gut-related, some men's problem, or some PIBD, pelvic inflammatory diseases is there. So many things are there that can release to your back problem. Because when there is a back problem, mostly we go to orthopedic surgeons. Mostly we consult orthopedic surgeons and whatsoever these says. But we never consult a gynecologist female mostly. But they should, if he is not being relieved with this proper treatment and guidance. Investigations, how no, this is the problem. Is the only simple thing is go for the MRI done. This is the MRI, even you can also make it out. This is the disc, this is normal looks, basically the gel part. You're looking up that this is a gel part, this is the nucleus pulposus. This is coming out and this is putting pressure of this spinal nerves. Simple MRI can give you the diagnosis. And you should know, it is not only, you should always ask your doctor to explain what is there in this MRI. It is not that difficult to make it understand. You can make it out. This is the disc is creating problems. How much it creates problems. There are other views. It can make it out for the right side or left side. Because if you really want to know, you can know. If you do not, if you get the MRI done, Dr. Sina here says no problem is there. No. Ask your doctor to explain what is there. It is very easy to understand. Because this is not reversible. This is the irreversible problems. You should know once the disc is, how long it will be there. The thing is that if you follow the instructions, if you follow the exercise, follow the schedule, sometimes the water content of the disc is absorbed and it retracted. It is more retracted, there will be less pressure in the spinal nerve, it will be relieved. But if you feel that this will go back here, no, it will not go back. It will never go back. So what you can do, you can follow the instructions, you can follow, that's why I'm here. Many of you may be some problem in the back. You do not know exactly what is there. Doctors may say, go for the MRI done. You have done the MRI also. Still you are confused. My problem is not over. Why it is not over? Because this is not a reversible problem. This is the irreversible problem. What you can do, you can stop, because more nucleus pulposus may not come out here. There will be more pressure. If the pressure is going increasing, your symptoms will go on increasing. End of the day, you might have to go for this surgery. Conservative management and surgery. These are the two options. Conservative management means without surgeries, good posture. You see, none of you sitting in everyone is sitting in a very bad posture. This is posture. After 30 years, you change your postures, your more than 50% problem is over. Change your posture not only here, in the workplace also. Good posture is very important. If you have any problem in the knees, your backs, in shoulder, you try to recover. See, if you have sleep in the back posture, you may have problem in the neck or maybe a problem in the shoulder. Basically the posture that makes the difference. You change your posture. After 30 years, you should change your posture. You should know how to sit, how to lie down, how to get up from the bed. That is very important. Bed rest on the hot bed, this is very important. How many of you go and check your mattress? You never check. You should check your mattresses, because right now it is a time you should change your mattresses. It should be an orthopedic mattress. Because mostly what happens, you're using this mattress maybe a couple of months, maybe a couple of years. Maybe some problem is there. Sometimes it bow down. There are some slants in the mattress. That may be a cause of your back problem in the morning. Mostly patients come and say, we have a more problem in the morning when you wake up from the bed. The problem is not the patient himself. Problem is the bed. Problem is the mattress. You change your mattress, your problem is over. So this is a very important thing, your mattress. Another thing is the exercise. Exercise is very important. Everyone should walk at least 2 kilometers a day. We'll let you know. And the stress therapy. If you have really stressed out, you should know how to distress yourself. It is your choice how to distress. Some people do yoga, or you listen to music, or some meditations, exercise, walking. You should distress. You cannot continue stress for the long time. You may have not on the back problem, it is bad for heart also. See, this is a posture. This is the posture we want. When they stand out, you put a line from this is the tip of your head, it should go straight. This is the right posture. If you stand, you should stand like straight. Because of the long guy, sometimes you bow down. If you bow down, your weight bearing axis is changed. It means there will be more pressure on this back. It will swings. Then you have more problem you may have prone for these back problems. This is a very important thing. The females walk in the kitchen, how they should walk. They should lift, because if you see, this is the wrong posture. This is the curve is there. The more curve means there is a more pressure in the lower back, and this standing like this for the long time, she might have problem in the back, because this is needed for the kitchen. If you anything pick up from the floor, you should pick it up like this, sit down, not this way. This is the wrong ways. You can have problem in the back, catch in the back. You to try to hold something, you should be as close to the body, not this is the, you see, if you are holding like this, there is a curve here. This curve means the biological axis, biomechanical axis is changed. It's more anteriorly, more front side. When the more front side, your mechanical axis is changed. More mechanical axis is changed, there is a prone for disc problem. This is the correct posture. See, that's extremely straight. There should be, weight should be close to your body. This is the proper posture you should sit. If you cannot sit like this, you can take a support for your pillow. Your back should be straight. Otherwise, you can take care of your hands also. This is the correct posture. If you are sitting down, this foot should be rest to the floor. If it is not, then you can take a small stool and it should be like this. It should not be like this. If it is holding like this, you may have a problem in the back and also these cup muscles. If you sit like this, if your office table is high enough, your foot is not going to this floor, then either you can put a small stool, or you can raise this, you can get a lower chair. But if you sit a longer time for this, then you have a problem in this back and these cup muscles also. This is called the cup muscles below the knee. This is the absolutely bad postures, downwards, absolutely bad posture. Mostly when you go back after office, long work in the office, you go back and sit down in front of the TV and sit like this. Sit like this, you have a problem in the shoulder and your neck. You relax. This is not a position you should relax. This is the driving, how you should drive. See, these are the small reasons. So you have a chronic problem. You have been worried. My problem is your back, I am not being relieved. It is because your posture. You change your posture, and believe me, 50% of your problem is over. You don't need to go for any doctors, any go for MRI done, nothing. Because in the aging process, there will be a little bit of disc problem, disc changes will be there. But if you change your habit, your more than 50% this problem is over. This is the way you should try. But another thing you should remember, many of the guys, you sleep like this. They put their heads over here. There will be numbness because there are so many nerves here which maintaining our movements here. When the nerves are getting pressed for the long time, there are chronic changes. Then you have a problem in the nerves, and that can reduce the muscle bulk, and you have a chronic pain every time. So this is you should sit like this, but your heart should not be, your neck. This is the way you should sleep. This should be sleep. This is the bad posture. If you sit like this, there is a curve is there, then biomechanical axis change, you will have a problem in this neck and problem in the back. This is absolutely not recommended. Your problem is the neck. Better to use a pillow over here. If you really want to use a pillow, use pillow like this, or you can pillow over here, but this is the bad postures. Yoga, I think it is right now, it is all over the world. People are doing yoga. It's very good. It's for distressing yourself, to increase your muscles power, flexibility, everything increases with the yoga. Your concentration's power is increases with this yoga and meditations. You can choose any one of them. These are the, I think, all over the world, they're already accepted. It is widely practiced in India, where I have come from. In the many of the Asian countries they adopt. Even in the US also, right now, they have accepted. Yoga is a beautiful, you can say, the exercise module or whatsoever you feel to care of your stress. Basically, distressing yoga is one of the most important things, and meditations, if you can do it, is very good to control your blood pressure also. This is pain clinic. See, right now it is very difficult because if you have a chronic back pain, you cannot take leave for the longer times. Now, this is very popular in the Western world, and I think here also you are practicing this. I've been trained for this, USA for this. I'm doing the minimal invasive spine procedures. This is a pain clinic basically, but it is not that popular in the Asian countries, and absolutely popular in this Middle East, and maybe in the USA, people are regularly using it. Because there is no complications, it's immediate relief, because in USA, everything depends on the hours there, because you cannot be absent to work for the longer times. You should go back to your work as early as possible. If you have the back problem, if you're not cared properly, it can take 15-20 days. You cannot work like this. In such cases, this is called the epidurals. These are the procedures, some injections are there. They're particularly mentioned, particularly it is moduled like this. Wherever there is a disc problem, it goes here, and we inject some drugs, and you retract the water content, and you get the immediate relief. This is a beautiful procedures, widely practiced, but many of the persons, they are not being trained properly. If you're not being trained, then definitely outcome will not good. But trained guys, it gives a very good result, and you should opt for this. It's a good one. Surgery, there are so many surgeries out there. Right now we have endoscopic surgeries also, daycare surgeries. Morning work, evening you can come down, but issue is that surgery is not the solution of the back problem. If I have seen it, couple of discs are there. And if you treat for the one disc, maybe tomorrow, maybe another disc problem. So first you should prevent it first. Before going for a treatment, going for a surgery, you should commit yourself. You should not follow their bad habits, what you had previously. You should change your habits. If you are not changing your habits, even you go for a surgeries, after a couple of months, a couple of years, you may have a problem with another disc. So this is the laminectomy. You decompress remove the part of these bones, and you decompress these nerves. These are the way we deal with this back problems. So back problems, basically it relates to your postures, and you can change your posture, and you can get rid of this problem mostly. You can check your beds, you can check your way you sit, way you lie, and your stress. Distressing is also another very important factors to get rid of these back problems. I'll just finish my talk, then we'll talk, okay? This is another problem with the knee problem. Knee is more common with the females, and it is seen more in the Asian guys. The 20% is more with the female patients. See, this is the cartilage. We cannot regenerate the cartilage, because day we can regenerate the cartilage, these surgeries will stop. Because the cartilage is very sensitive. There are a few tissues in our body which you cannot get back, like this cornea where you see retina, then the blood vessels, inner lining, there is the cartilage. Once it is damaged forever. We cannot regenerate the cartilage. So this is the problem with this knee, because this is the weight-bearing most important joint with us, because the knee joints, every time we move, this is the hip joint and knee joint. Asian guys is more prone for the knee problem, because our rituals are like that. We sit down on the floor, we pray on the floor like this. So we are more prone for these knee problems. So this is the cartilage. When it is damaged, it looks like this. When there is a knee problem, we go for X-rays, only the standing X-rays. And if both the sides should be equal space, this is the perfect knee. You have to go for this MRI done. You go for a standing X-rays. If the space in both the sides is perfect, then your knee is perfect. See what is happening. This is the perfect. This space is reduced. This is more reduced. this knee will get you a lot of problems. Now, we don't want to be here. That's why I'm here. Because this needs surgery. You can stop, we want to be like this, or even if this, you can get rid of this problem with exercises, change your lifestyle. But once you have reached this, there is no question of you have to go for surgeries. So you have to commit me, all of you will be, this only will not come across here. Okay? This is a commitment I want from your sides. See, this is the normal knee, this is the orthotic, this needs surgeries. What happens? When there is a pain, we just restrict our movements. Because when you stand, when you walk, there is a pain. We start sitting, more we opt for the sittings and lying down, more weight. Then upper half is the more weight, gaining weight. When there is a more weight, there is a more problem in the spine and more problem in this knee. Why these two are related? When there is a knee problem, always starts with the one knee. If it is a one knee, right knee problem started, you will start putting our weight in the left side. So there is a lurch. If the problem is my right knee, I will walk like this. I will take more weight on the left side, I will walk like this. When I walk like this, our biomechanical axis has changed. When biomechanical axis is changed, weight of the body, it is not distributing either sides, right and left side equally. Because you are putting more weight on the left side, so more weight on the left side, less on the right side. It means the disc are not equally weighted distributed. Left side disc will be more prone for rupture. So this is the related things. So another thing is why is both the things, until and unless your posture, your walking is very important. If you're not walking straight, maybe any reasons, it will affect your knee, hip and your spine. This is a cartilage breakdown. When there's a cartilage damage, there's bones are coming out, extra bones, because cartilage, they prevents growing of the bones. When there's a cartilage damage, extra bones comes out, which gives the pain. These are the initial injury. See, these are the movements, job requires, these are prone for these knee problems. Your profession requires squatting, kneeling. These guys are more prone for knee problems. But these are job demand, you have to do it. How can you come across this problem? You have to just strengthen your muscles around knee. You have to strengthen your muscles around, because it is very difficult to change your, in certain time you cannot change your profession, it's very difficult. You have to go for this. This is your job. Restore the functions. You are not able to move. You want to move. Then disability, because of the pain, sometimes you will confine to this room. We don't want to come out. We just want to come out of this and rehab. Rehab means we again go back to this original stage. Lifestyle modification comes first. Everywhere I see the lifestyle modification is very important. And the physiotherapy means the exercise schedule. They show the particular exercises. I will also let you know what are the exercises you should do for your knees. This is a non-steroid anti-inflammatory drug. This is the drugs we don't prefer much of these medicines right now, because they are creating so many problems on your kidneys. Braces you can use, support you can use. These are the things you should note. What is the lifestyle modification? Sitting on the ground, it is a very bad. You should not, that is a bad, that affects more of your knees. Squatting. I think the Asian guys, they need to go for this more of the squatting. Squatting and sitting on the floor, it is more with this Asian, more with the Indians, and you can say the Bangladesh, and we guys are more sit on the floor, having our food. This is rituals we have from the lifelong. Even if patients come from the joint replacement surgery, they ask after surgeries whether we'll be able to sit or not. If not, then we'll not go for a surgery. You have to convince, no, after surgery also you can sit cross-legged. Okay, then I'll go for surgery. But the issue is that why the knee are damaged? Because of this, the way. There's a bad posture. Climbing is a bad posture. Commode. You should use the commode, not the something. Have you seen that Indian style of this toilet? I think many of you maybe that part of the system. That is a bad way. You should not use that way of this toilet. High heels, shoe modification. I'll let you know how it works. Walking, lifestyle modification, walking instead of running. People say that running is better. No, if you really want to run or jog something, your shoe wear should be perfect. You should know how to jog. Best is the brisk walking is the best. You should not jog in the hard surface. You should always try to get it off this soft surface like grass. If it is not available, you should have a proper shoe wear before start doing this jogging. Then walking with the limits of pain. This is very important. If you have a pain, you start walking more, because when they started your pain, still you're walking. There is a lurch. When there is a lurch, your problem in the back and your knee problem will be more worsens. So there is a limit. If your back is creating problem, your knee is creating problem, you stop, not at all, you don't walk. Because with the pain, if you try to walk, the muscles will go into the spasm and your whole things will be more aggravated. This is very important. See how many of us check the shoes. This is very important. The shoe should be like this. If it is eroded, if this eroded means while you walk, the lurch is not because anything, only because you have been using this shoe for the long time. And see, this is is eroded. It should be absolutely like this. That is creating problem. That is lurch is because of that. You see my shoe is absolutely fine. There is no problem. Why should I change it? You should change the shoes because of this. That might be because of this you may have a problem in this knee and problem in the back. This is absolutely bad heels. You should use the platform heels, females. Otherwise that can lead to your back problem and your calf muscles problem also. This is absolutely bad postures. Even another thing is that the shoe should not be very heavy. Everything, any shoe you wear, it should be light, more straight. If it is more heavy shoes, then give the bad posture. If you are putting a heavy shoe for the long time, then definitely you will have a problem in your heel and your calf muscles. Calf muscles means back of your knees. See, what is the golden rules of the exercises? Do it regularly, do it correctly, don't overdo it. You should do it, every day you do it, but never overdo it. Overdoing, sometimes it gives bad for the This is overdoing. If you say there is your time to relax also. That's why we say is you work out for 5 days or 6 days, 1 day you can off. You can relax. You should give time to relaxation of your muscles also. Overdoing doing these very bad things. Now few people feel that if I walk, my knees will be damaged, so I should not walk. This is the other thing is that you should walk more, your knees will be perfectly fine. If you don't walk, you will be like this only. This is very important. 10% extra pounds can put considerable loads on the joints. Weight. Check your weight. Most dangerous things is your weight. More check, you are more prone for diabetes, more prone for blood pressure problem, more problem your back. All things will come with the weight. You can easily reduce your weight. That is not a very difficult thing right now. But you have to accept it first, you are overweight. If you leave it, no, this is normal way, I am doing it for a couple of years, I am perfectly fine. No, it is not the issue is the perfectly fine. We want you to be perfectly fine for at least for the age of 90. That's why. That's why we are here. We want to live healthy. At least how long, as many as long years we are here, that doesn't make a difference. We want to be a healthy living. That's why we are here. This is continuous activities can cause pain. Now marathon running, this is a common trend right now. People go for the marathon. They don't run regularly, but suddenly one day they started doing it. I mean, recently there is 4 guys died on doing this marathon in India also. But thing is that these are the strenuous activity. If you are not prone for that, you should not do it. See, I can do it. I can run for 20 kilometers. So it is not necessarily you can do it. You can do it, but it will damage your joints. It will damage your back. If you are regularly doing it, you should know how the age of 45, age of 50, age of 55, if you really want to run marathon, then you should spend sufficient time. You should know in and out of how to do the marathon, how to do the run. What should be your diet plan? What should be your weight? What should be everything? You should be planned. It is not necessarily I am spending 12 hours in the office. I never walk, never run. Suddenly, end of the day, I feel that I can do it. I am doing it. End of the day, what happened? I am being more problem in the knees. I am not able to walk for 1 month, and it become a common. After that, I cannot walk. Now, insufficient poor quality sleep. This is another stress hormone activities of the female sometimes more prone for this problem. This is when you do not have the proper sleep. Sleep is very important. If you do not have proper sleep, any pain, any muscles problem is more. You see, if you can also make it out. If you are not sleeping properly, all muscles problem it goes because muscles get relaxed when you sleep. We are not getting sleep. There are 2 types of sleep. One is the REM, one is the NREM. NREM sleep is deep sleep. Sometimes we sleep, but we don't feel fresh. We slept for 12 hours, 10 hours, but we are not feeling fresh. We are some dreaming or something like that. That is the REM sleep. That doesn't make a name. That is not the way you should do. We should do NREM sleep. NREM sleep is a deep sleep. Our body relaxes in the deep sleep. Now, this is the depression. This is another very important cause right now in the stressful life. Depression. This is the back posture. This you should not sit like this. This is the squatting. This is the cross leg sitting. Now this is another thing, cycling. This is a treadmill. Now people are doing a treadmill, but if you want a treadmill, don't make it elevated. If you're doing the elevated, there are more stress on this joints, patellofemoral joints, the knee joints with more stress. If you're really cycling, one thing to remember, we advise cycling, but cycling is not reduce your weight. It is reduced for your strength in the muscles around knees. These are the certain exercises. I can give you all the exercises if you're interested. This is the exercises which will enhance the muscles around your knee joints. These are the exercises. Since I'm a joint replacement surgeon, I let you know a little bit of what we do in these joint replacement surgeries. This is a knee replacement. We remove this part, then we put this is the metal, this is the metal, this is the plastic, this is a joint, this is the normal knee, this is the arthritic knee, this is a replaced knee. Sometimes we are doing now the part of the knees, only this part is involved, only remove this, the partial knee replacement, this is a total knee replacement. We are doing this is a computer navigated surgeries. This is the more precise. 0 degree, you cannot make it the BRIs, we can do only this computer. These are the advantages. Even after surgeries also you can sit like this. This is the demand in the Asian population. They want to sit like this, but you can do it right now, but we don't advise to sit like this even after surgeries. See, this is a game changer. This is the before surgeries, this is the immediate after surgeries, this is you can say in a month.
What is this?
Knee surgeries. We have done the both knee replace. This is this surgery, this is the patient immediately after surgeries, this is after 1 month. We have changed both the knees. See, both the knees are damaged. This is before surgeries, this is after surgeries.
By saying immediately after surgery, you're allowing them to
walk.
How much time is normal?
See, the thing is that the before surgery is pain and after surgery is pain, you can say 10%. So they walk. They walk because the pain is more before surgeries. Yeah, that's why they walk. And they can do everything, climbing stairs and everything. See, this is 114 kg. This guy is from Oman. This is immediate after surgeries. This is 118 kg. This is the before surgery. They're walking without support. This is 104 kg weights. Because people are very scared when they're overweight. They're overweight because they don't walk for a couple of years, putting on weight. This is 114 kg. See the condition of the knee. Because they have been bedridden for more than a year.
How old they are?
This patient is 68 years, female. Not walking, not beyond bedridden for more than a year. All scared, they're scared for the surgeries. They start walking gradually. Say, this is a day before surgery, pre-op, they comes for the surgeries. This is immediate surgery, they start walking. This is the third day they are walking without support. This is basically the beautiful procedures, knee replacement surgeries. We are putting all the stitchless surgeries we are doing. We have to go for this. And anyone of the Hindi, this is the patient I operated, 96 years old. He's the oldest patient in the world. He's still alive. This is Hindi. This is the world record. 96 years, operated in 2014. Patient is still alive. And hospital we are working with the 6 best hospitals in North India. Thank you very much.